من المواطن عبد الكريم سعد الله من العراق الموصل. اكتشفنا المرض في جسمي قبل 5 أشهر تقريبا. راجعنا أطباء كثرة بالعراق وأخذت جرعة بالعراق تقريبا 6 جرع بدون فائدة بدون جدوى. بعدها اتصلنا بالدكتور الجبوري فنصحنا بمستشفى ماكس دواك.
A young patient, he came from Iraq. He was having a big tumor in the lower abdomen pelvis and it was coming into the left thigh. It was Chondrosarcoma. He had already received a few cycles of chemotherapy but of no use. The tumor did not respond, rather it increased in size and it was compressing, it was putting pressure on the urinary bladder, the rectum and also the nerves. He was not able to walk. So he came to us, we did some evaluation scans to find out what is the situation. It was a resectable tumor and we planned a surgery.
The challenge was to take out the tumor, take out the part of the pelvis from where the tumor was arising and re-stabilizing the pelvis. So it was a mammoth job, meticulously take out all the tumor, preserving all the internal organs and then reconstructed the pelvis using the pelvic stabilization plates.
We successfully removed the tumor. It was a long 10-hour surgery.
ونجح العملية والحمد لله والشكر. وأخوي هسه بصحة جيدة الحمد لله والشكر، فضل الله وفضلهم، فضل مستشفى ماكس دواركا ودكتور الجبوري، دكتور سنجيف، دكتور ديباك